UNICEF and volunteers at Soul for Good have partnered together to analyse children's exposure to air pollution during COVID-19 lockdowns globally. We developed an open air quality platform to understand concentrations of PM2.5. Our research team consists of UNICEF researchers and a group of volunteer data scientists. Over 500,000 children under 5 years old died from air pollution-related causes in 2016, and millions more suffer from respiratory diseases that affect their development. Children are uniquely vulnerable to air pollution due to both their physiology and to the type and degree of their exposure. Therefore, we aimed to assess whether fluctuations in air pollution due to COVID-19 lockdowns has affected the number of children exposed to high levels of air pollution. We are motivated by the lack of a proper model to account for heavily fluctuating air quality levels, leading to uncertainty among public health professionals on the exact levels of children's exposure to air pollutants. In locations where air quality data is available, historic data do not capture COVID-19 related air quality trends. There is an increasing need to develop a model that explains temporal and spatial variability in air pollution concentrations to accurately assess the global child population exposure to high levels of air pollution. The method we use to model global PM2.5 concentrations is as follows. First, we calibrate remote sensing data using Google Earth Engine and ground observations of PM2.5. We then use this to develop a machine learning model to predict and interpolate PM2.5 values globally. We analyse children's exposure to PM2.5 changes during COVID-19 lockdown events using child population density and school location data. And we develop an open air quality platform for UNICEF's regional offices to visualise regions of high air pollution. We use data provided by OpenAQ from air quality monitoring stations across the globe using a sample size of 1,600 stations. We calculate the weekly average from the ground level PM2.5 values, which acts as our target variable in our model. We acquired remote sensing data for AOD, NO2, population density and precipitation from Google Earth Engine and used the weekly average values as predictor variables. And we collected this data from January 2019 to September 2020. We predict PM2.5 concentrations using an ensemble machine learning model. The model leverages the capabilities of a range of well-performing models to improve the accuracy of PM2.5 predictions over and above any individual model. And we use child population density data from UNICEF and school location data from OpenStreetMap to measure exposure to high air pollution. We calculate children's exposure to values of PM2.5 that exceed the WHO standards of 10 micrograms per cubic metre of air and 25 micrograms per cubic metre of air, and we built an open air quality platform containing layers showing child population density, and we overlay polygons indicating geographic regions of PM2.5 concentrations above the WHO limits. In this video, we demonstrate exposure to the air pollutant PM2.5 before and after lockdown in Vietnam. The areas shown in peach exceed the WHO standards of 10 micrograms per cubic metre of air, and the areas shown in orange exceed 25 micrograms per cubic metre of air. Through this work, we developed an initial model, along with the expert comments from a multidisciplinary panel, and demonstrate the results to UNICEF's regional offices in Vietnam, Peru, and South Korea. In response to our platform, UNICEF's regional offices want to increase the number of ground stations measuring PM2.5 concentrations within areas of high child population density, and together we charted a roadmap for progress towards a broader goal of developing locally tuned models through iterative feedback from relevant stakeholders. I want to say a large thank you to the team at Soul for Good and UNICEF partners for supporting this work.